I view the healthcare system as one of the slower industries to kind of look themselves in the eye and say, what do we need to do to care for our clients, our customers, our people who have disabilities. Movie theaters have had to do it, you know, cruise ships have had to do it. The Supreme Court made sure of that. But it's just been, frankly, really interesting that the healthcare system hasn't. And the healthcare system, I've tried to figure out why that is, why I think the healthcare system has really not been at the forefront of making sure that, that their facilities and their communication and every aspect of their policies, et cetera, is accessible. And the only explanation that I can come up with is because the underlying mission of healthcare is beneficence. It's being good. It's doing humanistic good work for people. And there's an assumption that if you need to be moved, we will move you. You know, and so you should not have to move yourself, you disabled person. We are here to help you move. So the person with a disability, if they can't get up onto the table because it doesn't automatically adjust to wheelchair height, the assumption is that the practice assistants or nurses will do that. Of course, there's a consequence to that. Not only does that mean that the person with a disability who might have the capability of transferring if the facility, if the table height is correct, can't do that independently, it also means that nurses and practice assistants are at much greater risk of occupational injury.
My name is Frances DeLoach. I've spent, first of all, I would say most of my life in hospitals for a couple of reasons. One is because, it was hard for my family to care for me. I have two brothers, and so, as, my parents had to care for them as well. And then with me breaking bones all the time, it was really hard to have to keep me home. One time I was going to the hospital and they put me in a room where I couldn't use the bathroom because the doorway was too narrow. And I said to the nurse, if you put me in a room where the bathroom's more accessible, I can take myself to the bathroom. That nurse's reaction was, oh, that's okay, we can just help you. Don't worry about it. You can use the bedpan. We'll take you to the bathroom. I said, yeah, that's a simple solution, but I don't want it that way. I'd rather be in a room where I can use the bathroom myself. They really need to listen to their patients. They need to think to themselves, oh yeah, well, she's had this disability. She knows what she's talking about. Let's take our cues from her.